Welcome to the White, Yellow, and Orange Belt certification programs for River Park, Victoria Park, Oasis Park, and Dental Strategy. Wait, what the heck are you talking about? Okay, here's a short presentation that will explain exactly that question. One of our struggles, a struggle that is also shared across businesses around the world, is how to keep our team always moving forward. The bigger the organization, the more people, the harder it is to have a full picture of what everyone is doing. The avid COVID and social distancing magnify the problem. We want to reward hard work and performance and give you the opportunity to grow at your desired pace. We have tried individual, team, or company-wide bonuses based on revenues on profit, but they were ineffective. Unless you have a business that is growing quickly or a business that is strictly based on sales, these are not very effective. Part of the problem is that it is very difficult to determine how to allocate the bonuses among team members. The end effect will see the overperformers not being rewarded enough and the underperformers being rewarded for doing anything, and someone always feeling as though they got the shorter end of the stick. What we need is a universal and consistent measuring stick. For inspiration, we turn to martial arts. And no, not Cobra Kai martial arts. Yeah, this one is more like us. Nice and friendly, where you get different color belts. With that idea in mind, we came up with a belt system. You start with the white belt and work your way up to yellow, orange, green, blue, purple, red, brown, all the way to black belt. For each belt color, you have a specific criteria of what is expected and a minimum compensation associated with reaching that belt. If you haven't taken any of the quizzes before, you may be asking yourself, what belt am I? Whether you're a volunteer placement, seasoned veteran with office management experience, everyone starts at the bottom and needs to earn all of their belts, starting with the white one. Earning a white belt is relatively easy. The next belt becomes progressively harder to earn. The reason why we all need to start at the bottom is to ensure we're all on the same page. All of us have a different level of knowledge and experience, and even those of you who have some knowledge at brown and black levels could be missing something at the white level. And a white level mistake can have a rippling effect on the entire patient experience. Therefore, before moving forward, we have to ensure that all of us are on the same page. Just like we have protocols and systems that run the practice, we need to have protocols that run the training of the practice. Every belt level corresponds with minimum compensation. Many of you have compensation levels that are higher than the belt that you're earning. That means that you should be able to reach that belt relatively quickly. In case you're wondering, your compensation will not go down. This dollar figure represents the minimum that you can earn at that belt level. At this point, we have set wages for the white, yellow, orange, and red levels, and we're working on the other colors. We expect that a black belt will earn a compensation of at least $46 an hour. We will know the exact details once we get to those levels. Your ability to get to the next belt level will be measured in 4 ways, based on your knowledge, skills, attitude, and responsibility. All of this information is available on Wiki. Knowledge is material that you have to read or watch on Wiki. Learn it and write a quiz. That simple. Skills can be acquired with practice. Clinical skills, photography, verbal or written communication, your creativity, problem solving, dealing with patients, and so on. Expectations with respect to these skills will be different at each belt level. Your ability to deal with the patient at a yellow level will be much different than on a black. For an example, a yellow belt, you'll need to be able to smile and say hello. While at a black belt level, you'll need to be able to deal effectively with an upset and aggressive patient in a way that they will not only stay, but become more loyal. Attitude is who we are and how we behave in a certain situation. Examples include hard work, dedication, friendliness, initiative, trustworthy, flexibility, dependability, ability to follow instructions, and most importantly, be a team player. We hire for attitude and train for skill, and since you're working here, it's because you have a good attitude. Still, this is an area we always need to work on, especially when you get to the higher levels. To get to the higher levels, you need to be able to deal with people, especially upset patients, teammates. You need to have the empathy and ability to make others feel good. These are skills that you develop with experience and being around other really good people. Responsibility refers to your position within the organization. At the lower levels, you're responsible for your own actions. As you move up the belts, you're responsible for more of the success of other people and the practice. The more responsibility you take on, the more valuable you are, the higher the belt level and the financial rewards you enjoy. To test your knowledge at each belt level, you'll need to read and then learn the material. There will be a quiz on the questions covered. If you know the material, and you will do very well on the quiz. We want everyone to pass. The questions are not meant to trick and confuse you, but we do need to ensure that you read and know the content. The questions are meant to test your comprehension and understanding, not your ability to memorize and spit out information. To pass, you'll need a grade of 85%. If you get over 90%, you will earn even more. Since we haven't gone through the green, blue, purple, red, black exams yet, we don't know the compensation for them. So far, we have had 7 exams written at the white and yellow levels, and everyone passed. The amount will not be paid as a cash bonus. The team member will indicate an item or service that you would like to receive, and we'll purchase it on your behalf. I would encourage you to view this as continuing education. This program is open to everyone at Dental Park, including hygienists and dentists and everyone else. If you are a dentist, hygienist, or someone who is already in a higher income brackets than blue and above, you might think that there is little incentive to take the time and learn and get to that higher level. Even if the bonus for passing each level, you might be wondering if this is worth your time and effort. I encourage you to see this as continuing education first. The material in Wiki that you'll be learning is specific to our practice, but it is based on knowledge from the best dental business practice courses anywhere in North America. It took us 13 years to gather the best material and put it together. It is still a work in progress, and while it might not be as flashy with all the bells and whistles, I can guarantee you that this content is superior to any continuing education practice management course offered anywhere else in the world. You have access to do the study material. If you've worked for 3 months or longer, most of this material is going to be review. It is difficult to determine how much time you'll need to study. For some, it'll be a matter of just going through the material. For others, it'll take longer. That's why the study will need to take place on your own time, and you will not be compensated for the studying. However, you will be compensated for answering study questions. They do not need to be answered in the traditional way with a pen and paper. You can take a screenshot on your phone and send it to us. Typed answers will not be accepted. You will also need to clock out during the time that you're writing the exam. However, if you want to discuss something about the quiz, challenge the content, results, or if you have any ideas on how you can add or improve Wiki, you'll be compensated for that time at your regular wage. For this reason, we want to encourage anyone who is going through the learning to share your comments, thoughts, and suggestions, and to add to the quality of the product. Knowledge isn't a concern. It will continue to change and evolve as we do. It is important that it remains relevant and up to date, and we need you to do it. The exams are not meant to be hard. At this time, we've had 5 individuals who have written a hybrid of a white and yellow exam before we split it into 2 exams. 3 out of the 5 did it within their first week on the job, and everyone received over 85%. You do have to review the material. If you don't, you will not do well, regardless of how long that you've worked here. Here are some tips for studying so that you can get your belt faster. 1. Understand, not memorize. The objective of this quiz is to help us be better at the job. It is not to memorize every word by word. For example, it is important to us to know the 3 pillars of River Park Dental, so it will be on the quiz. We will not ask you specific questions such as, name the 12 skills that we are looking for in successful team members. 2. Practical. You do not need to memorize things that you will have in paper in front of you. You might get a question, for instance, what are 3 checklists we use at the end of the day? We're not going to ask you, what are the 20 clinical things on a checklist that you have to do when closing? 3, ask questions. The purpose of this is not to trick you so you feel you cannot get to the next level. We want to get people to that next level as quickly as possible. So if you are struggling or you're frustrated or it's taking too much time, please ask questions. 4, stay on track. Only study the pages you need for the quiz. Once you start reading, you will notice that there are many links from page to page. You are welcome to click on them and read them, but you are not responsible for the knowledge in these links unless it specifically says you are. These links lead to pages at higher belt levels that you will eventually need to learn. So there is no harm if you do so, but if you are looking to get through it quicker, stick to the assigned pages only. 5, your practice. Most of the content is relevant to all practices. There will be some items that are specific to one of the practices. And if it's not relevant to your practice, you do not need to study it. If you work at River Park, you don't have to know the specific billing for barter pay patients. And if you work at Oasis Park, you do not have to know the specific information about holistic dentistry. You'll be able to skip these questions on the quiz. At the bottom of each page, there are study questions. If you can answer them correctly, you will do well on the quiz. You will notice that each question has a number in the bracket. This is the unique question ID. This helps us keep track of all the questions in our question database. That way, if we need to discuss or modify any of the questions either during the study or on the exam, we can quickly reference it without any confusion. Whenever you see this sign, the T with 2 lines, it means that this is only as a reference. For example, this page lists all the conversations. You will be responsible for the information and links leading up to this page, but there are no questions that you will be responsible for on this specific page. You will not be asked questions to name the 20 different types of conversations. That would be totally useless. You will see at the bottom that there are no study questions. And because I'm such a nice person, you'll get this sheet for your quiz, but the main categories will not be labeled. You do not need to memorize the parts, just understand them. The goal of the exam is to be practical. If you don't know all the sections, that's okay. It is important for you to understand the overall picture so that you can apply it to your day-to-day work at the practice. The quiz is open to everyone at Dental Park, including hygienists and dentists and everyone else. While getting a higher belt will not impact your hourly compensation directly if you are a dentist, and only at the higher levels if you're a hygienist, the knowledge will make you stronger team members, which will result in the growth and success for everyone, including yourself. Due to COVID, the exam is only available online. Contact Emily and she will send you the link. The quiz is timed. Questions will consist of multiple choice, true and false, and short answer questions. You can do it at the office where you work or from the comfort of your home. We would like you to record when you're taking the quiz. Not only do we want to give you the feel of it being a real quiz, we want to see how much time it takes for each question so that we can improve it for your colleagues in the future. Again, if you know the content on the wiki, you will do well on the quiz. Not all questions that you study on wiki will be on the quiz. If you fail to get 85%, you will need to rewrite the quiz. Your current compensation will not be affected. On the knowledge page, we have made 3 videos. The first 2 discuss the patient experience cycle, the evolution of the model, and the logic behind it. The third video discusses more of the structure of Wiki. I recorded the first 2, and Matt did the third one. They are over just 20 minutes long. All the content is relevant. If you are short on time, just increase the playback speed, but don't skip any parts. If you're ready to get started, email Matt and he will send you the study material. Once you're ready to write the quiz, as mentioned, contact Emily and she will send you the link. Most importantly, good luck.